Welcome to the 412th of the COVID calls. This is a daily discussion of the COVID-19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Knowles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today is February 13th, 2022. Today, I welcome social epidemiologist SHARRELLE BARBER back to COVID Calls. Just a reminder, you can usually catch COVID Calls live on weekdays at 7 p.m. Eastern Time. This is a special COVID Calls episode on a Sunday at 8 p.m. You can hear COVID Calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID Calls via Twitter using the handle @US of Disaster or @COVID Calls. Please do help spread the word and send suggestions for future guests and future topics. And as we're moving to about a month out now from the last of the COVID calls, will be taking place on March 16th, or at least the last for a little while, please do take me up on that offer of sending suggestions for guests and topics. As of February 13th, 2022, according to the Johns Hopkins University Coronavirus Resource Center, there have been 919,640 deaths from COVID-19 in the United States. Brazil reporting 638,346 deaths. Philadelphia County, Pennsylvania, reports 4,868 deaths from COVID-19. I've been reading an obituary or a story of advocacy for those impacted by the pandemic, and I'd like to continue that now. This is an obituary that was brought to all of our attention by the Faces of COVID Twitter feed. If you're not following Faces of COVID, I recommend that you do. This is the obituary of Barry Brent Doss, which appears on legacy.com. Barry Brent Doss, 46 years old, of Beaumont, Texas, passed away on Sunday, February 6th, 2022, from complications after having COVID. Brent was born on September 2nd, 1975, in Houston, Texas, to parents Barry James Doss and Ruby Gail Lawson Doss. He was a lifelong resident of Beaumont, Texas. He was a recovery coach for people recovering from addiction, and he was a dedicated member of Impact Church. He loved helping people, and his mission in life was helping others through their recovery journey. He loved the Dallas Cowboys and would always show off his Cowboys pride. He loved listening to contemporary Christian music and sharing the Word of God to anyone who would talk to him. Brent was a loving son and a beloved brother to many. He was preceded in death by his mother, Ruby Gail Lawson Doss, his maternal grandparents, Ida Pearl Lawson and Woodrow Lawson, and his paternal grandparents, Eugenia Doss Bell, James H. Doss. The obituary of Barry Brent Doss, age 46, who died this month of COVID in Beaumont, Texas. Okay, let's turn to our conversation for today. And I'm really delighted to bring SHARRELLE BARBER back to COVID Calls. And she's been on the program twice, so let me reintroduce her for those who have not met Dr. SHARRELLE BARBER. She's a social epidemiologist and scholar activist in the Dornsife School of Public Health of Drexel University in Philadelphia. Her research focuses on the intersection of place, race, and health, and examines the role of structural racism in shaping health and racial ethnic health inequities among Blacks in the United States and in Brazil. Dr. Barber currently serves as the director of the Ubuntu Center on Racism, Global Movements, and Population Health Equity, which was launched in November of 2021. And her research work and academic commentaries have been published in journals including The Lancet Infectious Disease, the American Journal of Public Health, Social Science and Medicine, among others. She's lectured and taught nationally and internationally about the impact of racism on health inequities and serves on the Group for Racial Equality International Advisory Board for The Lancet. SHARRELLE Barber, welcome back to COVID Calls.
Thank you so much for having me back, Scott.
It's great to see you again. And I would like to start the way I generally do, just to find out where you're calling from and how the pandemic looks there today.
Yeah. So I'm calling in from Philadelphia, Pennsylvania, and the pandemic is still ongoing here. I do believe that the numbers locally have been on the decline from the Omicron surge that we experienced. But the numbers are still high. I was looking at a map from the CDC that shows kind of like the low, medium, high levels of transmission. And in Philadelphia, along with the rest of the country, the map is blood red, meaning that there are high levels of transmission, though the numbers are declining. So that's where we are here.
I've been asking guests for a while now if they wouldn't mind sharing a memory of this pandemic. And since I've had the benefit of speaking to you twice already on COVID Calls, I wanted to get an update from you on that. We talked last in November, just around the time of the election, November 2020. So in COVID time, I don't even know how long ago that is. But I wonder if you wouldn't mind sharing some personal memory of this pandemic since that time.
Yeah, gosh, everything is blurred. Wow, that is a long time since we've chatted. A personal memory. I'm trying to decide whether I share a sad one or a more happier memory, and I think I want to go with a more joyful one. And so, one of the most significant memories I have is the visit from my partner, who actually is based in Korea, back in June of 2021. We met in grad school at Harvard, and he's been teaching overseas for over a decade. Reunited during the pandemic, and one of the memories we had is we did a photo shoot of our kind of reuniting in the city over near Germantown, and we were literally what I describe as chasing the sunlight because we were trying to get to this certain spot before the sun went down. And so that whole idea of trying to like drive through rush hour traffic to catch the light at the right time so that our photos would turn out nice was really great. It was nerve-wracking, but the photos actually turned out really nice. And the reason I bring it up is it's part of what I call that our photo album from that afternoon, chasing the sunlight. And I feel that like during this pandemic that has really been so dark in so many different ways. You just, spoke of 916,000 COVID-19 deaths just in the US. You read the obituary of an individual who was 46 years old and passed away from the pandemic. And so glimmers of light and glimmers of hope have been the thing that has kept me through this pandemic. And that has either been on a personal level or the ways in which I've seen communities, stand and continue to stand. So just trying to find some glimmer of light and chase that light and hold on to that light because it's, I really do think that we'll need it for what we continue to go through in this pandemic, but also if we're really committed to learning from this pandemic and doing, really creating the just and equitable world we all deserve, because the pandemic exposed so much in terms of how inequitable we are. So that kind of that moment, that memory for me was one of the bright spots of the pandemic.
What a beautiful memory. And thank you for sharing it. And I can totally picture it because in Philadelphia, first, it's a beautiful city to try to take pictures in, but you're always fighting against traffic, as you said. But then the skyline and buildings and the power line over here, it's cluttered, right? So I can only imagine them running and trying to catch the right spot.
But we found it. I mean, changing clothes and we had to do a wardrobe change and everything.
That's fantastic. Oh, well, that's great. Well, good luck and thanks for sharing that. I wanted to follow. We were chatting a little before we got on today about the numbers, and I have been at odds with myself about, reading the COVID numbers has been something I've done from the very beginning of COVID calls since March of 2020. But over the last several months, particularly, and I had a guest on who actually he directly challenged it in a friendly way, but he said, those numbers aren't right, and you need to be talking about excess mortality. But I don't want to read the numbers, but at the same time, it gives a reference point on where we are. And so I've struggled with that, and I'm not an epidemiologist, so I'm struggling with it more at a conceptual level than at a level of like, what can I say about the data itself? So that's why I want to ask you, because you can actually tell me.
Yeah,
what about these numbers?
Yeah, no, that's what that is a challenging point. So I think, before we got, on, I was talking about, at least with the cases, there's some estimates that the cases that we see, there's about 4 times more cases, than what is actually what we have an official count of in terms of the deaths. I don't know that the magnitude of the deaths, the error in the deaths is that much, but there's still more deaths than what's officially counted. And which is one of the challenges I have, as we back here in the States have, begun this, let's go back to normal, all restrictions need to cease, and we just need to move forward. And my problem with that is that actually gets that diminishes the fact or ignores the fact that we don't have an accurate picture of what's happening in terms of the pandemic, that we have not set up the appropriate data systems and surveillance, here in the States, that other places, for example, Korea, has, to be able to, the numbers are so that we can prepare accordingly, so we're not always reacting to what's happening, but we can have a real sense of what's happening nationally at a state level and also at a hyper local level, so that the restrictions can be based on data. But if we don't have the proper data, we can't make decisions about whether or not we should be opening up or what restrictions we should be putting in place. And so, and then even when we talk about the cases, we've often said, well, that, here, many places, the cases are declining. What we fail to say with that is that, yes, the cases are declining, but those numbers are still higher than some of the peaks we've had over the course of this last 2 years. And so numbers do matter. Getting the proper data does matter, so that we can effectively, in this stage of the pandemic, really, do the things that are necessary to keep people safe. And so that's been my challenge, with, what we've had here in the States, is that it's just that we don't know, that it is a gross undercount of what the real picture is. And that is not good for when we're trying to make decisions about what to do. The last thing I'll say is that it also means that, we'll have this global impact, right, of what the pandemic has been, but that disproportionate impact, the not knowing the numbers is not good, especially for the communities who have been most harmed during this pandemic. So that's also, challenging. And the thing that I think about are the equity and the justice implications of not knowing the data, of not having an accurate picture, because we know who's going to bear the brunt of the decisions that are made.
Let me go a little further with this, because time matters a lot here too. So if I have you right, from the perspective of, let's say, a public health office at a state or local level, you're more interested in the case numbers than you are in the death numbers. Is that right?
Well, we want to know quite a number of numbers. We want to know cases, absolutely, because we want to know what local transmission is. We want to know, how is the virus circulating, because that's who's got it, and where. We do also want to know deaths. And we want to know hospitalizations, because we need to know, like, where are our hospitals in terms of the capacity to be able to properly care for the folks that come in, right? So we need to know a wide range of data, on the cases, and we need to know, are the numbers going up? Because if the numbers are going up, then the cases are going up. We need to think about what are the mitigation strategies that we need to put in place. The fact that we're moving towards these, like, getting rid of mask mandates, I think is challenging, because that is literally kind of making, it's just opening, it up for, continual spread, continual transmission. And, for me, it's like, you don't put your umbrella down in the middle of a rainstorm. You continue to have, this is a proven public health strategy. And we have, from the local, state to federal level saying, we're just going to go without masks. And that, I don't think that's not okay. And they said, well, it's not as severe, or folks aren't, the symptoms are milder. I was just reading a study on the kind of long-term consequences, for those who don't die but have it, even some who have mild symptoms, the cardiovascular consequences. One of the largest study on that came out in Nature just a few days ago, showing that there are long-term implications for things like stroke and myocardial and heart attack. And so we don't know, what, those long-term, we're still trying to understand that, even for people who just get it, don't die from it, maybe not even have a severe case of it, right? So we do need to know the, transmission, we need to know deaths, we need to know hospitalization rates. All of those numbers matter so that we can make good decisions about how to mitigate those numbers, but also to think about the equity implications for certain communities as well.
So, and just one more question on this, because we are approaching, whatever you think of the undercount, pretty soon the United States, too soon, will hit 1 million deaths unless something drastic happens. So there's gonna be a week. There should be a lot more, but there'll be at least a week of discussion about that. So then the number sort of stands in as a marker of something that goes beyond public health surveillance. And I wonder what you think about that. I mean, how will you talk about that number, 1 million, when you will be asked inevitably by the media, Dr. Barber, what should we make sense? What should we say about that?
Yeah, so I talked about the 900,000 on Twitter the other day. I don't know if you noticed, but I put something, I said something to the effect that our acceptance of mass death is inhumane, period. That was my tweet. And it was because I was sitting with the fact that we had just passed 900,000 deaths a couple of weeks ago, and that we are rushing back to this quote unquote sense of normalcy. And I got 14,000 likes on that tweet alone, because I think that there are a lot of us who are grappling with the fact that this is mass death, unavoidable, so many of those deaths being unavoidable and so many of those deaths being unjust. But it seems as if there's an attempt to just try to brush over it and move forward, right? And for me, it is calling, and that's just in the US, so don't even talk about what's happening globally. But for me, it really is calling into question, for me, our sense of shared humanity. Like the fact that we can accept kind of that last, that amount of death. Because again, these deaths are not just deaths, they're mamas and daddies and children now, even more, and grandmamas and granddads and aunts and uncles and, pillars in the community, right? They're people, they're souls. And I think it's a question of our humanity when during this pandemic, there's so much of that death that is unjust and unavoidable, and that we're willing to, just continue on without any reflection on what can we do better to mitigate those deaths. So I think, last week, I was just very troubled because of so many things, but I was deeply troubled. In fact, I have an online course that I teach, about 30 students we meet once a week. And I paused, I said, before we get into the content for this week, I want us to just sit and reflect on this pandemic and the really heartbreaking milestone or grim milestone that we just kind of all had to bear witness to. And the students were, one, grateful. They're like, no one's asked us to sit and reflect. We haven't had an opportunity to sit and reflect. I thank you, Dr. Barber, for giving me an opportunity. And folks were sharing stories. We have some public health workers who've been on the front lines of this in different capacities that were sharing stories of their exhaustion. They were sharing stories of, what it, has meant to lose loved ones too soon in some ways. There's stories of how like this rush back to normal, is putting kids under 5 especially at risk because they're not vaccinated. And so for people to say, oh, this is the unvaccinated, this is, now the pandemic of the unvaccinated. Well, you're talking about kids under 5, right? Where we don't even know what the implications, the long-term effects on them are going to be, even if they have mild symptoms now, right? And so again, that number for me is an indictment, really, on our humanity. This pandemic has shown so many of the deep-seated wounds of our country and our world. And for me, I'm also like, did we learn the lesson? Like, have we learned the lessons of this pandemic? Because it seems like we haven't, we still don't have no value, disregard workers. We're still not giving them the kinds of protections they need. We're not even giving that. We weren't even willing to pass legislation to give them a living wage. We called them essential, patted them on their backs, got them nice pins, but still haven't, had enough compassion and empathy to say, we need to be paying folks what they deserve, especially since they were on the front lines, very beginning, helping to keep this economy afloat. We haven't even talked about what's happening to individuals caught up in, in the carceral system and the ways in which we've totally forgotten about incarcerated individuals or homeless individuals or folks who are at risk now of losing their homes because of the economic hardship. It's as if there's a whole swath of folks that we are choosing to forget who have been devastated by this pandemic. And we are choosing to move on as if nothing has happened. And that, again, I will continue to say is an indictment on our humanity.
I'm glad you said it so clearly and directly. And it's been something that's troubled me a lot, that it's not only coming from those who you might have expected, politically, who from the beginning have tried to minimize the pandemic for political reasons or economic reasons, but also coming from people who are self-described Democrats or independents or whatever, who are sort of, and this is in mainstream publications on social media and everywhere that I follow, and it goes a little bit like this. Yes, it's been hard, and yes, it's a good thing that Biden has done better than Trump, but there's some people who seem to want this to go on forever. That was actually tweeted over the weekend. And I just have a hard time with that framing, because what it does is it puts people it puts you, in what you just said. It tries to put that in a box over here and say, this is a person who is somehow worried about this too much.
Yeah. And
I don't know what you say to that, other than
it's been challenging. Yeah, no, it's been challenging because I wrote something. So New York Times, May 24th, 2020, when we reached 100,000 deaths, the headline was, U.S. deaths near 100,000, an incalculable loss. At 100,000, that's what it was on Memorial Day weekend.
Yeah.
So I have an op-ed that I've been trying to shop around. No one's picking it up, and I think I think it's a concerted effort. 900 souls and an incalculable and inhumane loss of life. Right. And you're right. There's these people. So, and then the other part of it for me is I went to a place that has done a pretty decent job of controlling the pandemic. Right. There is actually a different way to do this.
Can be done.
It can be done. And so that's my part of it too. It's like, it can be done, and again, nothing's perfect. No system is perfect. But as I told you before, when I was in Korea, I felt safe. I felt like people had, the people in decision making, who had decision making power, had set up a system for if the cases go up, this is what we do. If the cases are going and the deaths and hospitalizations are going up, this is what we do. These are the restrictions we put in place. And there's a clear, this is what we do if. We don't have a systematic, this is what we do if here, right? And so to say that we're overreacting somehow negates the fact that there are systems that actually have worked. When I got back, so I went to Korea, was in quarantine for 10 days. They checked and double checked my test status, my vaccine status. When I got back to the US, the TSA folks at Customs were saying, you don't need to show your test. You don't need to show your vaccine cards. Put it away. Just show your and it was just like, I was coming through Atlanta airport.
Yeah, wow.
And they weren't even checking the antigen test that I took before I got on the plane, nor were they checking me for my vaccination status. That's a simple mitigation strategy to put into place, and that was not even being done. So for people who say, "Oh, you all just get over it," come up with a plan.
Right.
Come up with a plan, and then I'll get over it. Because again, the plan has been get as many people vaccinated, and that's it. And that plan has failed because vaccination alone was never going to get us out of this pandemic. And so we needed the multiple layers of prevention strategies in order to get us to a place where we could go to some semblance of quote unquote normalcy. And even then, I think that's even a false, thing to reach for, because normal before was killing us, many of us, right? So anyways, that's
so much there. And I want to turn to talking about your new center, but I just want to highlight one part of it, living here in Korea. So it's gotten normal for me. I've been here for a year. And the Omicron wave is here now. And so the government is not able to provide, so there's stress on the testing system really for the first time, because up to now it had been, if you need a test, I might get a text message from one of my child's school saying, go get your child tested, and you literally go, and then later that day you have the result. And so because of the stress on the system, they've had to pull back on that, and people are relying more on home tests. And that, just even you get that, but when I describe that to people in the United States, they're like, I don't even understand what you mean by that. Like, what you mean the government is having you, what are you talking about? And it's a real powerful, we should keep telling that story, I think, too, because it's a chastisement for those who say, oh, let's just get over it. Like, are you saying that whole, countries like South Korea should just get over it? No, they're playing it for real here.
Yeah, absolutely. And that's what that's what I've tried to explain to my, to friends and colleagues. It was just a different feel to be there for a month. And then this is the other, I think, misconception is that it's just going to be so constrained. I've actually felt, I traveled to multiple cities. I was on public transportation, went to restaurants, all those things. And so I didn't feel this whole idea is it's just going to be constrained. That just wasn't true. There were things we couldn't go to restaurants after 9 o'clock. Okay, we just stayed at home and, ate and things like that. So it was just like this whole notion that, oh, it's just taking away my, liberties and freedoms, et cetera. That's just a false misconception. And there's a way to do this that is, this is how I say it. Centers equity, justice, and dignity. Centers is informed and with community, informed by data, and uses everything in our public health arsenal to mitigate the impact of this pandemic. There's a way to do that, and the fact that we have chosen not to, that's on us. That's not that there, because there is a way to do this.
Let me remind folks that you're listening to COVID Calls, and I'm talking to Dr. SHARRELLE Barber today. And SHARRELLE, the Ubuntu Center on Racism, Global Movements, and Population Health Equity launched late in 2021. Congratulations.
Thank you so
I
much.
know this was maybe in the works a little bit when we talked last time. So
Mm,
this didn't just come out of nowhere. I mean, this is a reflection in many ways of the work you've already pledged your career to,
absolutely.
and the bringing together of social epidemiology, um, uh, racial injustice work, and narrative, and the
Hmm.
power of storytelling and community memory. There's a lot that goes into it, and I'm not
Yeah,
even doing it justice. Can you tell me a little bit of the backstory and what kind of projects you're working on?
absolutely. So there's a lot. So the first that I remind folks or tell folks is like it really was born out of the pain and the power of this moment, right? So this disproportionate impact that we've seen of the COVID-19 pandemic on Black, Latinx, Indigenous people, poor people, working class people, the calls for racial justice against state-sanctioned violence and other forms of violence against Black bodies that we experienced in 2020, and the power that we saw in global protests against those horrific murders. All came together in this moment as an opportunity for us to create a center that really grappled very seriously with the issues of structural racism, the ways in which it has been propagated historically, not only in the United States, but other parts of the world. And then thinks about what are then the anti-racism solutions that we need to be thinking about in order to have the more just and equitable world that we all deserve. It brings together scholars who are doing this work at Drexel. We're also recruiting for 2 new faculty, which we're really excited about. We've also, we're connecting local activists and folks who are kind of on the front lines of work in various areas within the city of Philadelphia, but also in other parts of the country and also in Brazil. And we are really, like you said, attempting to amplify the lived experiences of those most harmed by racism in an effort to really disrupt and change the narratives around the existence of racial inequities, but also to highlight the ways in which our communities have been on the front lines of transformative change through the power of organizing and social movements. That for me as a Black woman, I've seen the ways that our communities make ways out of no ways when the systems that have been built and structured to devalue and destroy us, we still continue to make a way. And, we saw that in the pandemic, in Philadelphia, for example, the Black Doctors Consortium, that COVID consortium that came out of the need to provide services, testing specifically, and vaccines to our communities when the systems and structures that were supposed to do that failed us, right? The ways in which there were communities that, our communities came forth to provide things like food and those kinds of things, again, when the systems and structures failed us. To say that embedded within our communities are some of the answers, some of the solutions to these problems. Now, the onus on the responsibility isn't theirs alone, but there's so much transformative power that's embedded there, right? And so we are trying to create a model of research that is action-oriented, really thinking about issues regarding segregation and housing and climate justice, among some of the issues that we're interested in. And then figuring out ways, again, to connect that to the work, the advocacy that's already ongoing on the ground, so that we're not just doing research for the sake of research, we're doing research that matters and research that can have an impact most closely, or a bigger impact. And so a couple of ways we're doing that is we're continuing some of the work of COVID in Context, which was work where we were amplifying the stories of folks in communities in Philadelphia. We're also doing projects that document kind of the historical legacies within Philadelphia, looking at how things like redlining and housing issues, for example, just got a paper, a colleague of ours who's on the Strategic Council just led a paper on, for example, redlining and heat vulnerability, showing kind of the correlations between those long-term disinvestments in communities, and what that is now having implications for the climate crisis that we're currently in, right? So, doing things that help us to understand better how racism operates, and also connecting, like I said, with colleagues in Brazil. So there's really powerful work ongoing in Brazil with colleagues there. And so, trying to connect those dots, trying to make those connections so that we can amplify these issues. The last thing I'll say about Ubuntu is that it was the name. Ubuntu is a South African principle that means I am because we are. And that reflects our deeply human-centered approach to anti-racism. So one of the things that I think, a lot of folks are now talking about racism as a public health crisis, and it's become a buzzword now. And some folks are mostly focused on the data. Data is important. However, we're saying that so much of this is beyond just the numbers. These are people, these are communities. How do we make sure that we center humanity? Even as we're doing the work that we're doing within the center. And so we say it's not an anemic commitment to solidarity without responsibility. It really is a commitment to radical truth-telling. It's a commitment to really disrupting and dismantling the systems that have caused so much harm, but also daring to reimagine what could be, right? What could replace these systems and structures that exist. And so we're in year one, we're still building and growing, but we've tried to create a different model for how to do this work and how to have real impact.
So just to follow up on a couple of parts of this, a lot of the papers you published and co-authored are really, they have a strong technical dimension around the sort of spatial distribution of health disparities.
Absolutely.
And I want to dive into that just a little further, because I also noticed you participated in a conference last year at MIT about AI, artificial intelligence, and healthcare equity. So there's a lot of enthusiasm right now around how AI is going to be the way we hoover up all this data that we need that's been missing. And I think it's a good impulse. But then we can automate a lot of that and not have to worry about that. And in public health, which is chronically underfunded around the world, you can focus on the interpretation and not having to spend all your time going out there, getting the data sets right. We can just trust AI. To do that, you expressed a little skepticism in my read of it, helpful skepticism of the enthusiasm for AI. But let's go a little further with that. What is at the cutting edge of how the technical side of how this work is being done?
Yeah, I mean, so my skepticism was the title of my talk will something about the master's tools. It was an allude, to Audre Lorde, and really can the master's tools dismantle the master's house? And this push for the solving of issues with technology, I think, is challenging for me because some of the real what needs to be done to advance equity from a social structural determinants of health perspective and really a structural racism are things that aren't technical things, they're like, provide adequate, secure, healthy housing for communities, make sure that individuals have equitable access to healthcare, right? So those are, so there's like these fixes that actually resources would be nice, power to communities would be nice. The technology can be helpful, but if we don't address those root causes, then the technology might actually amplify some of the divide that already exists. And so my skepticism is that technology can be a part of how, perhaps we're able to get more information. But again, the way our society structures itself in such a way that maybe the information, once we get it and it goes through whatever AI, configurations, that it is itself skewed because it is a reflection of the racist society in which right? So that's where I am. So if we're creating solutions based on AI, which is created on a racist system, will we actually end up perpetuating that racist system? And if we don't actually address and put resources towards the things that people need, the very material, concrete things that people need, will AI actually solve the problems? And so that's where I am with, pushes for big data and technology as the kind of silver bullet, when we know that some of the fundamental root things have just not been addressed.
I mean, some of the data sets we need, it seems like, I mean, your work already points to, I mean, you've done work on, let's say, the historical implications of redlining.
Yeah, right. I guess
health.
if there's a way to speed that data processing up, perhaps. But again, I'm just leery, because always the new shiny tools, and don't get the fundamentals right. And that's where I sometimes find challenge.
I just want to bring in the sort of perennial, and we're back into it in the United States, the sort of perennial rebirth of racist attacks on the history of structural racism.
Right.
And so now we're in another one of these moments in critical race theory, which I can't imagine any of these state legislators who are pushing these bills in various states against teaching critical race theory really have ever read it or know anything about it. But it's already having a chilling effect in classrooms in K-12, I know. I wonder how much you worry about that in terms of public health. I mean, the kind of public health research that you have done and that the Ubuntu Center is doing is taking on board the history of racism as a public health determinant, and then how that also creates structures of racism. Those are inherited and then recreated consistently. Are researchers going to be able to continue? I hope you can continue to do that work with funding in Philadelphia, but what about Atlanta or Miami or Houston?
Right. Absolutely. I mean, I think that, there's always going to be a challenge to this work. And what I've learned from colleagues who've been, and really, I consider them elders in the field, right? So folks like Kamar Jones and Mindy Fully Love and folks who've been doing work around these issues of structure and racism and other systems of oppression, right? Like, they did it. I'm a church, a preacher's daughter, and they did it in season and out of season. They've done it, when it was popular and when it wasn't popular. One of my really good friends and colleagues, Dr. Chandra Ford, she was integrating critical race theory into public health practice, create a whole way of doing that with her public health praxis works, critical public health practice work 10 years ago, over a decade ago, right? And it was not popular then, but she continued to do it because it was important. The work, I think, will continue to go on. Whether or not it will get, all the millions of dollars, I don't know. But there's a critical mass of scholars who are committed to this work, who we understand what's at stake. And so we're just committed to doing this work. We are grateful at Drexel to have the Ubuntu Center, to have some initial funding for that. We will continue to go after, different kinds of funding for that. And we'll do the work while we can, and we'll do it when it's popular and it's the buzzword, but we'll do it when it's not, because it's about the work, it's about the impact. So am I worried? There's always backlash, right? We're seeing it now, right? Could there be, backlash? Absolutely. That is part and parcel of how this system works, right? When you challenge it, when we show it itself, it doesn't want to, face it. So will there be? Perhaps. But what we're thinking about is how do we kind of take this moment that we've been in, where more and more people are seeing it clearer than even 2 years ago. There wouldn't be no Ubuntu Center had we not experienced the last 2 years. And so while we have this moment, we're going to do the work, and we're going to push forward. And it's not just me or just the Ubuntu Center. Again, there is a whole powerful group of scholars who are now doing this work. And I don't think that we're going to just sit down that easily. So
and to just follow up a little bit on that, because to bring it back to COVID, it's a moment, I guess. I mean, for chronic disease, it's playing out in real time everywhere in America. So you can do sort of slow moving disaster epidemiology and bring
Mhm.
in the history of race. And people have done that. And they look at 5 different cities or something like that.
Mhm.
But this is
Mhm.
a disaster in real time, as you point out.
Mhm.
It's played out over these 2 years in the United States. So maybe we're just at the start of something, do you think,
Mhm.
in terms of
Yeah,
making sense epidemiologically? And
yeah, perhaps we're creating a movement. To
are you?
perhaps. We're trying. I think it's
Yeah.
neat, it's necessary, right?
Yeah.
So again, Scott, I mean, we've been in a pandemic that has taken the lives of nearly 1 million people just in the US alone. We had to bear witness to violent acts of state sanctioned violence. And we know that that's just the tip of the iceberg of what really
Right.
happens, right? And for me and so many of my colleagues, it's like, if we don't take this moment, and push for something more, and if we don't make use of this moment, you know, um, I feel like I can't not, take I would feel like I've let my ancestors down. I would feel like I've dishonored the death that we've had to bear witness to. And I'd also feel like that I have relinquished my responsibility to generations yet unborn. That if I, in this moment where it's been made crystal clear, don't decide to push alongside of my colleagues on these issues, then that would be, that just, I mean, it would just, I wouldn't, I know that this moment is what the moment that I came into the field for.
When
And
young people come to you and say, I wasn't aware of what structural racism was before George
mhm,
Floyd was murdered,
mhm.
and they ask you, so do I go into public health to do something about that? What's your answer to that?
I think absolutely. You go where you feel like you have a passion. I think public health is one of those spaces you can go into, absolutely. But I tell people in this moment, we need all hands on deck. So wherever you feel moved and led, you could go into sociology, you could go into engineering. We need some people to figure out how we're going to get through this climate crisis and build the kind of equitable, thriving communities that are going to get us through this climate crisis. We need people, in all sectors. What we saw in the pandemic is that, yes, it was fundamentally a health problem, but so many things came into, intersected to produce what we've seen in terms of its impact, right? And so, yes, public health perhaps is your field, but it could be something else, again, that brings together the necessary pieces to help us understand how we got here, but also help us to understand how we move forward and do things better.
I think there's always been an activist strain, and I don't know how core it's been in sort of mainstream public health education. Maybe
Mhm.
it, of course, will depend on the time period and the program. But I want to ask you about the tension there, because I hear it every day. You get an activist or a scientist. We've been hearing about this for a long time, right? There's
Mhm.
too many scientists in the climate crisis are activists. They need to stick with
Mhm.
the science and let the politicians do their thing. And I've heard that with public health too.
Yeah.
Back in the Black Lives Matter protests and criticism of public health,
Mhm.
researchers who were encouraging people to go out and protest against racism because racism is a public health threat. Imagine
Mhm.
that, and to try to explain
Mhm.
that. But I mean, now in this moment in time, and you're a person who has to help train the next generation, you're helping to
Mhm.
form curriculum. What about that tension, or is it a tension that you don't acknowledge and
I
you
don't
move
think it
past it?
has to be. I actually don't think I think it's dangerous that we don't support those who see themselves, as being able to contribute academically and scholarly to the work, but also actually have an impact. For me, activist just means you want to act, you want to have an impact. It's not,
Right.
we've created this I think we've created the tension, but public health is inherently so I think about public health. It is a field of action, right? You have to do something about it. And what I think I at least witnessed in this pandemic is that if we choose to just stay on the sidelines, decisions are going to get made, whether we do anything or not, right? So we should at least voice, with the knowledge, with the understanding we have, we can have a position. Does that mean we are left or right or Republican, Democrat? No, it means that we are, we understand the political processes, how resources and necessary resources get distributed, and we choose to engage strategically in order to advocate for the very public we say we care about. That's for me what activism is. So if I have some data that show this community is being harmed, and I just choose to just I'm just going to sit here and produce the data, I don't choose to act in a way that attempts to have an impact, then what am I doing with the research? Because that's what public health is. You use data to then inform action. And I mean, so that for me, it's not a tension. It's not, they're not, for me at least, they haven't been mutually exclusive. It in fact is the reason I came into the field. Public health is social justice was the first line of my doctoral application. And I believe that to this day, and will probably believe that till the day I die.
We're almost up on time in a COVID calls discussion today with Dr. SHARRELLE BARBER. I just, thanks for describing the work of the Ubuntu Center and our whole conversation today. There's something sort of hanging over it, which is a kind of a deep concern about getting back to something people want to call normal.
Mm-hmm.
And my interpretation of what you described at the Ubuntu Center is it's a place that's dedicated to not normal, to not accepting the political conditions that want to push the country back into acceptance and forgetfulness. That's extremely hard work. And so, I mean, I guess a sort of concrete, question for you, just in the next 12 to 24 months, when policymakers in Philadelphia County or in the state come to you, get a chance to talk to them, and they say, well, wait a minute, everybody wants to get back to normal. How is this center going to help us get back to healthy, normal that we all want to have after this pandemic? You're going to have that moment. You probably already had it lots of times. How are you going to get through to them?
I mean, I think it is. I think part of it is building a critical mass of individuals, not just scholars, that where we craft both the data and the narrative around these issues and collective, not just with not just me as an individual, not just us as a center, but really building up the critical mass of individuals where there's folks who get it and can help to shape that narrative, right? So centering communities, centering activists who are already on the ground, who've done this work, right? And it really is that idea of the collective, right? Ubuntu I am because we are. Part of that means we're not doing this in silos or as individuals. It's the collective impact that we want to have. And so, and we also know that there will be folks who will not listen, who won't change their minds. But for us, we've got to try. We've got to, try to amplify the data, try to amplify the voices and the lived experience, and also offer up the alternatives, right, in concert with community. And we're not saying we have answers now. That's part of what the work is to bring communities together, to be thinking about, so what does this mean? What are the solutions? How do we, move these things forward? And that is a part of the learning process that is ongoing. It's a part of the relationship building process that is ongoing at the center, really thinking deeply about these issues to be able to say, this is how it is, and then this is how it can be.
Just want to remind folks that you've been listening to COVID Calls, and you can usually catch COVID Calls live weekdays at 7 p.m. Eastern Time. This has been a special COVID Calls on Sunday in the middle of the Super Bowl. with my wonderful guest. And a full disclosure, I gave her the opportunity not to do this call in the middle of the Super Bowl, and she
And I
said,
had,
no,
no,
let's
I
do
was
it.
totally oblivious to the fact that the Super Bowl was so,
Yeah.
I was like, oh yes.
But I just, just to thank my guest, Sharrelle Barber, the founding director of the Ubuntu Center on Racism, Global Movements, and Population Health Equity at Drexel University, and to thank you for your generosity and time and teaching me and others throughout this pandemic. Sharrelle, your work is amazing, and I appreciate you.
Absolutely. And I thank you for offering this opportunity to reflect, and also what you've done over the last almost 2 years, I guess now, to just make sure that we have an accurate account, a documentation that's really good. It's going to, be really so crucial, so that we don't forget, what we've been through. So thank you for the work that you do, Scott.
Stay healthy, everyone. We'll see you next time on COVID Calls.